What's the difference between hospice care and palliative care? A lot of people confuse palliative care and hospice care, so I'm going to talk about some distinct differences between the two. First, hospice care. Hospice care is end of life care. This is where a patient has a terminal condition. Typically, they will be passing away within the next 6 months. And the goal of hospice care is not to treat the patient's terminal illness, it is to provide comfort and allow the patient to have a peaceful end of their life. Palliative care, on the other hand, can be a little bit confusing. Palliative care is comfort care with or without the intent to treat. It can be started at any stage of a patient's disease. Patients don't necessarily need to be terminal, but their disease impacts their quality of life, their function of life. We will have patients that are still receiving antibiotics and pressors and oxygen and tube feedings and all of these things, and be getting palliative care to work on some of the symptom management that maybe they're experiencing with their diseases. Palliative care can transition into hospice care should a patient decline. Maybe now their disease is terminal. And I think that palliative care is very highly underutilized just across the board in the United States, but especially in the ICU. We actually have a palliative care team, which is awesome. I love the palliative care team. I think they play such a valid role. And a lot of times when people are approached by palliative care, they think that the conversation is like, this is end of life. Like they're going to tell me I need to pull the plug. And that's not the case. Typically, they're coming to you, presenting to you where the patient is currently at, where the patient's trajectory is going, some of the things that the patient's experiencing, and then talk about what would the patient want? What are their beliefs? How can we support this patient? How can we come up with a good game plan that puts the patient's comfort and quality of life first? That can look totally different case by case. Everyone has their own religious preferences, end of life beliefs, what they believe quality of life is. And so I think palliative care does a really good job at kind of bridging that gap for people. And that's hospice care and palliative care in a nutshell.